have a couple favorite moments as a nurse, and it always involves saving that person's life. And when you save someone's life and then you can see them, like I said, at the supermarket after, and they can give you a hug and say, like, I'm here because of you. And then every year, there's one man in particular stands out in my mind. Every year at Christmas, he comes through the doors at the hospital to see us. My name is Sarah Stratton. I'm a registered nurse. I work at Brookfield Bonnews Healthcare Centre out in Central, so about 45 minutes from Gambo. It's a small cottage hospital with a detached long-term care home. And in the hospital, we are responsible for acute care, emerge. We also cover community health and public health there, but I'm in the area of acute care and emerge, and I also work in long-term care. My mom was a registered nurse for 30 odd years on Prince Edward Island, and she was always the one that had the answer. She was the one the neighbors came to. She was the one that comforted and protected and took care of everybody. If anyone was hurt at home, they came to my house for mom to fix them up. So when I was about 10 or 11 years old, mom did night shift mostly. So there used to be this thing, take your kid to work day. Usually about grade 11, you go with your parent for, a shift just to get the feel for a profession and stuff. So when I was about 10 or 11, I bugged mom enough that finally she agreed to let me come with her. Anyways, I put on my little pink pants and my little pink shirt. This was my scrubs, and I went to work with mom for the evening. So 7:30 till 11:30 shift. And she plunked me on a chair next to this woman who was on her deathbed and all alone. She never had anybody with her. From what I understand and what I remember, she didn't have any family that visited or came, when family is vigilant at your bedside as you're going through the dying process is so important, and she didn't have anybody. So I sat in that chair and I held this little woman's hand and rubbed her hand for my shift, my 4-hour shift. And she did pass away, a couple days later or next day. But ever since then, I've just felt I was like, wow, I didn't do anything physically. I didn't do any work. I just was there for her, and I just, I felt that. And that's why I went into nursing. I guess one of the biggest things I want to see changed in the workplace is the mentorship program for young nurses coming in, or new nurses. They don't have to be young nurses, new nurses coming in from wherever to start with us, that they can get buddied up with someone who has been there for years, who knows the ropes, who goes through it, because every one of us has, the fear of change. And when you come into a new workplace and it's an unfamiliar environment, how nice is it to know that you've got somebody to lean on? So I'd like to see that mentorship program really pushed, and I would like to encourage senior staff to take that new person under their wing, be the mentor that you would like to have. And whether you had it or not years ago, I'd like to see you do it now. And I'd like to remind all staff coming in or people looking at the nursing profession that your union is fighting for you. There's so much work being done now to go against the violence that we're suffering in the workplace, to go against the imbalance of home and work life, that Yvette is working tirelessly with her team to make sure that this happens and changes are made to make things better. My name is Sarah Stratton, and I am a registered nurse.